This conference will now be recorded.
There we go. Okay, so welcome. My name is Julie Fietta. I will be the host of the webinar today. I'm joining you as a representative of University of Laval and the Cirrus Research Center and a proud member of the ACRM Neurodegenerative Networking Group, or NDNG. Today, our speaker is Dr. Melike Kahya, and she will be speaking on how to prevent older adults from falling and the effectiveness of clinical approaches. So before we get started with the presentation, I do want to again advise that this meeting is being recorded, and I'd like to ask all attendees to keep your phones or mics muted and to keep your cameras turned off throughout the presentation. We do expect to have about a 20-minute availability for discussion at the end of the webinar. So if you have any questions, please type them into the chat feature, and then we'll address as many of those as we can during the latter part of the hour. So with that, it's my pleasure to introduce our guest speaker, again, Melike Kahya. She is a postdoctoral research fellow at the Hinda and Arthur Marcus Institute for Aging Research, Harvard Medical School. She recently completed her PhD in rehabilitation science at the University of Kansas Medical Center. She received her bachelor's degree from Istanbul University in physical therapy and her master's from the University of Pittsburgh in neuromuscular physical therapy. Her research interest is understanding neurophysiology of mobility and falls in aging and age-related neurodegenerative conditions. She is an active member of the American Congress of Rehabilitation Medicine and serving as communications officer at the ACRM Neurodegenerative Disease Networking Group. Dr. Kahya, we look forward to your talk and will now turn the presentation over to you.
Thank you, Dr. Fietta, for your great introduction. If you can give me the presenter rights so I can share my screen. Yes. Thank you. Thank you all for joining for today's webinar. So, as Dr. Fietta mentioned, I'm going to present about how to prevent older adults from falling and effectiveness of clinical approaches. So after completing this webinar, the learners will be able to understand the impact of aging and cognitive impairments, imbalance in mobility, describe the risk of falls in older adults with and without cognitive impairments, and discuss the evidence-based clinical approaches to prevent falls. So I would like to start with some statistics about the falls in older adults. Older adults value their independence, and falls reduce their independence and to remain self-sufficient. Falls are defined as the unplanned descent to the floor or lower levels with or without injury. And people over the age of 65 sustain at least one fall per year, and this rate increases with increased age. 20 to 30% of older adults who fall suffer modest to mild to moderate injuries, as well as severe injuries. And the direct medical cost for fall injuries is total for $34 billion annually in the United States healthcare system. Older adults also suffer from cognitive impairments, which can be as a result of using medications, some nutrition vitamin deficiencies, or some underlying comorbidities. And there is a transitioning usually between normal aging and dementia, and mild cognitive impairment is a hallmark of the dementia. So, in the mild cognitive impairment stage, due to brain functional and structural change, balance, gait, and mobility are also negatively impacted. And because of that, that changes aggravate the risk of falls in this population. And when we look at the basic statistics for older adults with cognitive impairments, they fall as twice as much than their cognitively intact peers. And the deaths occurred due to fall is 30% of the older adults in that occurs in this population is the 13% for this population due to falls. Some of the cognitive treatments may also increase and aggravate the falls risk, such as medications or electroconvulsive therapy. In total, falls affect the rehabilitation, the functionality, length of stay, and discharge plan for these individuals, and increase the healthcare cost. Cognitive impairment itself is an independent risk factor for falls because it can impair the judgment, self-decision making, and lead to some more impulsive behavior. It also affects visual-spatial perception, which can make it harder to see what's on the floor, if there's an obstacle, or whether like to identify the patterns of the floor. So that's why it increases the fall risk. Also, gait and balance are altered due to brain functional and structural changes. It also affects sleep quality and also ability to recognize and avoid hazards on the floor. So in this figure, we discussed the risk factors for falls in older adults with and without cognitive impairments. As you can see from this graph, these falls are complex and multifactorial and has multifactorial reasons. So if we discuss some of the intrinsic reasons, factors that can lead to falls, one of it is age-related factors. So with aging, we see changes in the brain functional and structural connectivity. This can lead to impairments in balance and gait, which can eventually lead to falls. Also, we see a degeneration of the neuromuscular system, which lead older adults to become more frail and led them to fall more frequently. Poor posture and reactive reflexes are also related to aging, and also mood swings can also affect and increase the risk of falls. Some of the behavioral factors are with aging and cognitive impairment, people tend to exercise less and become more immobile. Inappropriate footwear, lack of sleep, nutritional deficiency, doing two tasks at the same time and not prioritizing their balance or gait. And also, again, impulsive behavior such as standing up, raising up from a chair too quickly or from bed, which can trigger orthostatic hypotension and can lead to falls. Some of the socioeconomic factors are like low income and education, social isolation. Again, since we're in the COVID era, that is something disproportionately affect older adults and can lead them to become more less mobile and then more tendency to have fall. Limited access to the healthcare system and inadequate community resources are also factors can contribute to risk of falling. And lastly, environmental factors, effects of inadequate lightings and supports, uneven sidewalks, unsecured mats and rugs, and poor stairway design are also factors can lead to falls. So in order to better understand the risk of falls for individuals, we have to use some fall screening tools. And here I list some of the most commonly used fall screening tools in the clinics. So one of it is Snellen eye test to measure the visual acuity and then the sensory function. And the interpretation of this test is if people are not able to identify 6 meters away and not able to read the letters, while normal people are able to read it in 12-meter ways, means that they have higher risk of falls. Also, a Berg balance test, which is commonly used to measure static balance. A score of 40 or less is associated with increased risk of falls. Dynamic gait index, which assess the dynamic balance during gait. And the interpretation of this test is if individuals score 19 or below, that can predictive of falls. Time up and go test is again some of the most commonly used tests, especially in the physical therapy clinics. Completion time of this test more than 30 seconds means people are dependent on their transfers and they have a higher tendency to fall. Functional reach test is another test. If the individual is not able to reach 6 inches or more while they're sitting, that can be predictive of falls. Falls efficacy scale assesses the falls, measures fear of falling, and based on this questionnaire, if individuals their score is closer to 64, that is the highest score, that means they have a higher fear of falling, which can contribute to increased risk of falls. Activities specific balance confidence scale, which measures the balance confidence while people performing variety of activities of daily living, that can give an understanding about individuals' confidence and their tendency to fall. And lastly, home falls and accident screening tool. It helps to identify older people at risk for falling because of hazards within their home environment. So we as the Neurodegenerative Diseases Networking Group and Alzheimer's Disease Task Force work on an information education paper to identify why people, older adults with and without cognitive impairments, are at high risk for falling, and what can be the strategies and interventions to prevent falls. So I'm going to briefly talk about the objectives of this paper. It was to understand why people are at risk, why older adults with and without cognitive impairments are at higher risk for falling, how can falls affect individuals in society, what are some of the evidence-based strategies and interventions to reduce risk of falls, and who can they consult if they have any questions to reduce their risk of falls. So the first strategy or recommendation was in this paper that we included is to doing exercise. So based on the literature, individuals it's recommended to do 4 to 5 times per week, and then any type of exercise, aerobic, muscle strengthening, balance can be helpful for these individuals, and then some of them which can help them to feel them more secure, such as walking, cycling, or swimming, can be particularly good. Also, some of the supervised group exercise classes at local gym and community center. Hopefully, spring is around the corner. Maybe there will be more opportunities for them to participate in group exercising outside. So here in this Cochrane systematic review, authors look at the interventions for preventing falls in older adults, and then they look at specifically exercise interventions. What they found that multi-component group exercise, so that means any type of the exercising, aerobic, or balance, or muscle strengthening, a significantly reduced rate of falls in people who are at high risk for falling. And specifically, they found the Tai Chi is effective to decrease rate of falls. Overall, I mean, any type of exercise is beneficial to reduce the risk of falls and to reduce the risk of sustaining a fall-related fracture for older adults. Another recommendation was to improve nighttime sleep. In this paper, we recommended for people to limit their daytime napping to 30 minutes, having a regular bedtime routine, and then avoid smoking, drinking alcohol or coffee at least 2 hours before bedtime. Also, it is recommended to limit fatty, fried, or spicy foods and carbonated drinks, which can increase the chest burn. Also, it's important to expose yourself to sunlight during the day and darkness in the night to have a healthy sleep-wake cycle. And then here in this study, authors look at the relationship between sleep disturbances and falls in older adults. And what they found that falls were significantly associated with poor sleep quality and increased number of awakenings during nighttime. Also, they also identified other risk factors for these individuals included depression, pain, higher score, higher completion time of time up and go test, and use of diuretics can also increase risk of falls. So overall, sleep is an important aspect of health and well-being, and having a good sleep quality might be an effective way to prevent falls in older adults with and without cognitive impairments. Another strategy was to strengthen muscles. Individuals may start with low weight dumbbells or barbells to strengthen their muscles. Also, some easy home-based exercises such as marching, raising arms, standing from a chair can be also beneficial. And right now it might be impossible to go to a local gym for older people, but again, there might be some innovative approaches for people like to let them stretch their muscles in outdoors. So here in this systematic review, individuals look at the effectiveness of muscle strengthening exercises to prevent falls in elderly people, and then they look at the studies which published from 2002 to 2012. They found the lower limb muscle strengthening activities. It's beneficial to prevent the falls and lower the incidence of falls in elderly subjects. So complementary and alternative medicine, it's another way to prevent falls. So starting with breathing exercises to relax, and then doing some movement patterns by which are suggested through yoga, qigong, or Tai Chi exercises can help to improve balance and mood. A study which looked at the effectiveness of Tai Chi exercise versus a multimodal exercise, including aerobic and balance activities. They compared the effect of these two to prevent falls among older adults. But they found that Tai Chi intervention was more effective than the conventional stretching exercise to control reducing the incidence of falls in older adults at high risk for falling. Also, Tai Chi was effective to reduce the incidence of falls compared to conventional evidence-based multimodal exercise. By multimodal, they mean aerobic exercise plus muscle strengthening. So that was kind of interesting results. So, and it kind of led me to think about maybe the Tai Chi exercise helps to improve the core muscle strength. That's why people have a better control on their postural, on their balance and mobility, which can be helpful to prevent falls. Another strategy was for older adults to prioritize their balance while they're doing balance and cognitive tasks at the same time, such as walking and talking. In older adults, usually they tend to give their priority to the cognitive tasks. So it's important to remind them while maybe doing one task at a time if individuals are not able to maintain their balance or give their prioritization to their balance if they're doing two tasks at the same time. Also, it's important to limit the distractions when they are walking or standing, especially in the crowded areas or challenging terrains. It's also important to modify the home environment and outside environment to reduce risk of falls, such as doing some home modifications by moving the ground, by not moving the ground if it's not uneven or slippery, keeping floors and surfaces clutter-free, simplifying the furniture arrangement to clear walking paths. Also, it's important to use proper lighting in the house, using contrasting colors in furniture and floor to make them easier to identify the objects on the floor. And using supports can be helpful, such as stair rails, bath rails, or toilet rails. A study looked at the effectiveness of home-based modifications to prevent falls in older adults. They did a home. They asked occupational therapists to visit participants' homes and ask for advices for possible changes, or offering facilities to do any necessary home modifications, and doing training for the use of technical and mobility aids. What they found that the intervention group had 31% fewer falls than the control group. Especially this intervention was beneficial for people who had recurrent falls in the past to reduce the incidence of falls. So home modifications, especially since we are all living at home currently, it's an important aspect to prevent falls in older adults. We mentioned about the importance of mental health and how cognitive impairments can aggravate the risk of falling. Some of the strategies to improve mental health might be using memory games, such as matching pictures of people or animals with their corresponding names, trying to solve puzzles, trying to memorize short poems or songs. Also, it's important if people feel sad, depressed, to ask for help from their care provider or from their healthcare provider, and participating in virtual support groups to seek for help about the mood fluctuations can also be beneficial to prevent falls. Another important aspect is to maintain a healthy diet and taking proper nutrition to maintain muscle and bone health. So it's important to eat a healthy diet rich in whole grains, in proteins, fruits, and vegetables. Also, it's important to get enough fluids and healthy fats such as olive oil, avocado, and nuts. So also for older adults important to watch their weight. A study has looked at the relationship between malnutrition and risk of falls in older adults, and they found that malnutrition is a predictor for falls in older adults. So it's important to screen and assess nutritional status to prevent and look for treatments for the malnutrition, which is an important factor for successful fall prevention. Also, it's important to refer these patients to the nutrition experts, such as dietitians, for them to receive advice and individuals' interventions. With aging and underlying comorbidities, the sensory functions can be affected, and which can also affect the foot sensation. So it's important to check the fit of the footwear. So usually it's recommended to use firm shoes with shoelaces on, and then making sure the footwear is appropriate for outdoor conditions. It's also important to not walk in socks or slippers indoors, which can aggravate the risk of falls. So a study looked at the relationship between footwear and falls as a secondary analysis from the Mobilize Boston study. So what they found that at the time of in-home falls, almost 52% of the people were barefoot, wearing slippers or socks without any shoes. And then 10% of the people said that their usual footwear was one of these, even in outdoors. And it was shown that among those who fell in their own home, they had a serious injury to those who were shoeless or wearing slippers compared to those who were wearing other shoes. So it's an important thing to having a proper footwear, and may perhaps even in home to using this footwear to prevent falls. Orthostatic hypotension, we kind of mentioned about that. So the recommendations to control orthostatic hypotension is to get up slowly from a chair, couch, or toilet, to do not move too fast, getting enough fluids, getting enough nutrition during the meals, and also it's important to talk with the doctor if individuals experience any of these symptoms. So perhaps doing some medication arrangements might be beneficial for these individuals. Lastly, social activity and being participating in social activities is an important part. So unfortunately, in the COVID era, older adults disproportionately affected by social isolation and loneliness. So hopefully with the technology, people might find some ways to connect with their friends and family, and also doing their routine, such as participating in religious activities or spending time with the loved ones. A study looked at the link between falls, social isolation, and loneliness, and so they found a bidirectional relationship between those factors. And also falls were consistently associated with living alone. So these are the strategies and recommendations that we included in our information education paper. So please feel free to print out and then share with your patients. And then I would like to now briefly talk about some of the state-of-the-art interventions to reduce fall risk in older adults. Our lab is specifically interested in the use of non-invasive brain stimulation. One of it is transcranial direct current stimulation to reduce dual task calls while walking and reduce falls in older adults. So a recent study which looked at the effect of transcranial direct current stimulation while individuals were performing motor and cognitive tasks. So they give the stimulation on the motor cortex and at the same time to the dorsolateral prefrontal cortex while people were walking and doing cognitive tasks at the same time. So what they found, the dual task cost was significantly reduced while individuals were getting the TDCS while they're actually performing the test versus getting the TDCS while they were seated. And also no electrical stimulation didn't show any effect on the dual task cost. So that might be a promising tool to use in combination with the conventional physical therapy approaches to prevent falls in older adults. The other state-of-the-art intervention is using virtual reality technology to improve balance and gait function in older adults. So with increased evidence, it's becoming more and more common in clinical use and research use. And one study has shown the effect of balance training using virtual reality in older adults at high risk for falling. They found that both exercise and virtual reality groups achieved better improvement than the non-intervention group. However, only the virtual reality group improved on their static posture in the eyes closed and foam eyes closed tasks. So virtual reality can be a practical alternative to improve the outcomes of balance training to reduce the risk of falling in older adults. One of the benefits of using virtual reality is that you can keep subjects or patients safe while they're performing their balance and gait activities. And also it gives you ecological validity. So such as you can work on obstacle negotiation task or crossing from a street task, which can help for individuals to adapt to use this behavior in the real time. Another state-of-the-art intervention is sensory neuroprosthesis, and then the study specifically look at the sensory neuroprosthesis called Volcasins, which helps to substitute the plantar, reduce plantar sensation, cutaneous sensation, and gives tactile cues while individuals are doing balance and gait activities. So in this study, they look at the effect of sensory neuroprosthesis in older adults with peripheral neuropathy. They found using this device for 10 weeks can improve the functional gait assessment score and also normal and fast gait speed, and as well as the time up and go test completion time. And also subject who reported falls in the prior 6 months showed a decrease in fall rate after 10 weeks of using of device. So that might be another promising tool to use future in the clinics for the reduced fall rate in older adults with and without cognitive impairments. Another intervention is using robotic exoskeletons. So initially, like I think everyone knows Locomat. So it was expensive and then heavy to use and has a lot of space in the clinics. But now with the new technological interventions, these robotic exosuits become more lighter, and the cost also start to decrease. So one study looked at the use of exoskeleton to correct human body posture and look at the balance performance after use of this device. So they found that the intervention group had a significant improvement in their short-term physical performance battery, Tenet scale, and pain scale, with a significant reduction in fall risk. So lastly, some of the commercial products, the wearable sensors can also help to identify people who are at risk for falling by looking at their movement patterns, or identify who already fall and need some help by looking by the GPS systems and wireless signals. So these can be also some of the tools that can be used by older adults. One of the caveat is the cost and not being able to reimburse by the insurance companies. So there is more data needed regarding the sensitivity and specificity of these devices in order to use in the clinical population. So with that, I would like to conclude my presentation, and here are my references. So I would like to open this for discussion and questions if you have any. Thank you so much for listening.
Wonderful. Thank you so much for that amazing presentation, Melike. So with that, if anyone who has questions would like to start putting those in the chat, we can kind of open to a Q&A. I have one question that I can kind of start with. I was just curious with some of those, the more state-of-the-art interventions you mentioned, things like TDCS and virtual reality. What are the perceptions, or I guess some of the acceptance considerations with this population to when you're implementing those sorts of interventions?
Yeah, in terms of safety, so it has been shown it's safe and FDA approved, but still, like I'm talking about the non-invasive brain stimulation right now. I think there is more data needed to use in the clinics. It might be an alternative, or maybe it can be used as a combination with the conventional physical therapy. I know people are using these non-invasive devices for like chronic depression or pain, so it just become approved to use in the clinics. But I think more data is needed for these to become more generalizable and applicable. And in terms of virtual reality, again, similar. I see some clinics have it and use it actively, but some of them are not. Perhaps the biggest barrier is the cost right now. But as I mentioned, it provides a variety of, it has enormous features to train, balance, and gait in a safe manner for older adults. But thank you for the question.
Perfect, thank you. Are there other questions?
I do have a question.
Wonderful, go ahead.
Hi, Melike. Great presentation. I learned a lot.
Thank you.
I was wondering about your suggestions on precision rehabilitation for falls. It seems that there's so many factors while people are falling. It can be vision, can be vestibular system that is affected, somatosensory system that is affected, environmental factors. So there's so many reasons why people fall. And it also seems that there's many interventions that can help alleviate or minimize falls. I do think that one of the drawbacks of the current state of the art in terms of fall rehabilitation strategies is that all the falls rehabilitation programs or fall prevention programs are standardized. And there's a reason why it's standardized in terms to interpret the findings. But there's also a drawback. People may not benefit from one particular set of standardized exercises. So I was wondering if you have any thoughts on perhaps moving towards precision rehabilitation, where we really clearly identify the reasons for a fall, or whether that is environmental, one of the modalities is affected, cognition is affected, and we really try to evaluate what causes the fall and really target those systems that are creating the fall. Do you think that that would result in better falls rehabilitation strategies, or what's your comments on that?
Yeah, that's a really great question, and I think it kind of gives the answer while you were asking the question. Yeah, it's a multifactorial problem. It's a complex problem. I mean, we cannot really focus on only one aspect of it to treat this. I mean, not treat, but prevent falls. But at the same time, I think while we are focusing on one aspect, let's say doing exercise, I mean, it can also help to have better mental health, better quality of sleep. Of course, your muscles become more strong, and your balance and mobility becomes more better. So I think, yeah, but of course, we have to as a researcher, we have to have a hypothesis that this specific intervention is going to specifically affect this outcome, but perhaps we might be able to also get some other results as well. And then in terms of better identifying what's exactly that person's need, I think that we need to have more mechanistical studies. Yeah, we have to see what are the specific changes in brain structure and functions, what's happening with the change, and then what outcomes it's leading to. So yeah, I think as a profession, rehabilitation professionals, we need more mechanistical studies to better understand the underlying mechanism for that individuals, to give a more precision medicine. So I hope that kind of answers.
Thank you.
Mm-hmm.
Wonderful. Are there any other closing questions? All right, then with that, I'll thank you, Melike, for that incredible presentation and for sharing your expertise with all of us. And thank you for each who attended today's webinar. This recording will be available in the next 24 to 48 hours.
All right, thank you so much for attending.
Thank you and have a wonderful day.
Great job, Melike.
Oh, thank you, Dina Kimuntan. How are you?